KSMQ Health Connections, local healthcare providers answering your medical questions. This week's topic, brittle bones.
Good evening. Welcome to KSMQ Health Connections, where we connect you to some of the finest minds in the medical field. I'm Ken Stone. Thanks for tuning in. We're going to talk about a condition that is called the silent disease because there are no obvious symptoms. You don't feel any pain. And that's one of the things that makes osteoporosis so dangerous. People don't realize they have it. Osteoporosis is a weakening of the bones, and a lot of people don't know they have it until they break a bone and then get diagnosed. A lot of people have it. Take a look at these numbers. 10 million Americans have osteoporosis. 44 million are at risk. They suffer from what experts call low bone density. For women over 65 years of age, almost 25%, 1 in 4 have osteoporosis. But it's not just a disease for women. About 5% of men over the age of 65 get it as well. And the cost in medical bills, $19 billion every year. So we're going to talk about what we can do to either avoid osteoporosis or treat it. And the good news is it can be treated. Dr. Sumit Bhagra is here to help us out. He is medical director at Mayo Clinic Health System in Albert Lea in Austin. He's got the answers. And here to take your questions are a couple of RNs. One of them is Nathan Hauber. He works at Prairie River Home Care. He's also a graduate of the RN program at Riverland Community College here in Austin. So give us a call. Our number is going to be on the screen for most of the show, and you can also send us an email. That address is healthconnections@ksmq.org. Before we get to your questions, let's hear what some folks in Rochester had to say when we asked them about osteoporosis.
Do you ever worry about getting osteoporosis?
Yeah, my maternal grandma had it, so I worry about it. Her diet was just Diet Coke, that's all. And then when I do go for my annual checkup, my doctor talks to me about it, make sure I'm getting enough calcium in my diet.
Do you ever worry about getting osteoporosis?
No,
And why not?
because I drink lots of milk.
Do you ever worry about getting osteoporosis?
I don't personally. I do take some supplements and stuff, but what I understand is it's more of a danger for female women that they have to be concerned about. They're losing calcium from their bones and not getting enough calcium from what they eat.
Do you ever worry about getting osteoporosis?
I do. And for some reason, like the bone is really important to support your body. So,
Do you know how to reduce your risk?
Yes, I do.
What kinds of things would you do?
Well, see the doctor regularly, and I believe they do a test called a bone density test. And then take the doctor's advice following the bone density test. And it may be as simple as taking calcium pills.
Okay, so Dr. Bhagra, why don't we start with the basic. Exactly what happens to the bone?
So osteoporosis literally means osteo is bone, porosis is the porosity of, so it becomes increasingly weak, brittle, and may break with minimal trauma or sometimes no trauma at all.
Because bones are porous, right? It's not a solid piece of, there's always some porousness to it.
Correct. So bone is a living structure, obviously, and it needs to be rigid enough with some flexibility in it to take the stresses of daily life. When bones become either too brittle or too hard, they paradoxically tend to break more often.
Okay, so talk about why do we get it?
So osteoporosis is a age-associated phenomena that as the aging program progresses, most people gain bone strength until about their 30. And think of it as, they're standing at the start line of decades of what might end up becoming osteoporosis. So as time goes on, due to hormonal changes and nutritional changes, people's bone strength starts going down, more so in women than in men. And that's one of the reasons why women beyond 60, 65, and men probably a decade later, tend to develop brittle bones.
Do we know why women more than men?
Yeah, so I think one of the readily available explanations is that women have menopause, which is a discrete event that occurs in the mid-50s, for some women slightly sooner, which tends to cause the estrogen levels to drop suddenly. In men, the decline in testosterone is more gradual and occurs over decades, and their levels never drop to the levels to a magnitude that women face immediately when they turn 55 or so with menopause.
Let's talk about some of the risk factors other than gender. Okay, let's talk about age, let's talk about family history, diet, all that.
So I think you named all the risk factors, the major ones at least. Older people are more likely to develop osteoporosis for reasons I discussed. Until about 30, we have this tightly orchestrated system of hormones, growth hormone, thyroid hormone, parathyroid hormones, sex hormones that literally take the body to its peak performance, both mentally, physically, cognitively, and skeletally. By 40 or 50, people who tend to have a wonderful lifestyle, meaning if they're active and eating a nutritionally balanced diet, they tend to preserve bone strength, and some others may start a decline that ultimately results in osteoporosis. So age is one of the commonest risk factors or the strongest risk factors for osteoporosis. Female gender, we mentioned women tend to get it more often and early on. Family history is another strong one. If your parents or grandparents had a hip fracture, particularly a hip fracture, or had osteoporosis, you may be at higher risk for developing osteoporosis as well. Some people may not remember if their grandparents had osteoporosis, but if you remember that your, say, grandma or grandfather had a hump on the back and they bent quite a bit as they grew to their 80s and 90s, chances are they had some osteoporosis as well. A fourth risk factor is medications that are commonly prescribed, so things like prednisone that might be given for asthma or breathing disorders, when taken over months and years tends to make the bones more brittle. Some anti-epileptic medications, for example, also make the bones brittle. Weight loss surgery, bariatric surgery or gastric bypass surgery is a very strong risk factor for early onset of bone loss as well.
Race also has a play in it?
It does to some extent. I think it's known that African Americans tend to have lower incidence of bone fractures, and that may be because of lifestyle issues or genetics or both. Caucasians do tend to have a slightly higher risk of osteoporosis. So.
My wife was recently diagnosed with osteoporosis. She hasn't even hit 60 yet. She's had the healthy lifestyle you've talked about. She hasn't had any family history whatsoever. She's done the calcium and vitamin D. I mean, she's done everything she was supposed to do, and she still got diagnosed.
Yeah. So, you know, when I talk to my patients, and I specialize in diabetes and metabolic issues, I often tell them osteoporosis is perhaps the only disease for which the risk goes up if you are normal weight or underweight. And I think many people who live a life that is pristine, you know, they're eating, doing the right things, taking the supplements, doing everything right. And if they end up with a body mass index, which is, 19 or 20, which means underweight to normal weight, their risk of developing a fracture going forward in time might be slightly higher than somebody who carries it a few extra pounds. So probably one of the things that goes up when people live a very healthy lifestyle. So.
No good deed goes unpunished.
As they
Yeah,
say.
very nice. If you're just joining us, this is KSMQ Health Connections, and it is a conversation not only between me and Dr. Sumit Bhagra from Mayo Clinic Health System, but also you. You can give us a call. The phone number is on the screen. You can also send us an email as well. If you have a question about osteoporosis, how to avoid it, or what happens if you've been diagnosed and you're not quite sure what to do next, give us a call. We'll bring you on into the conversation. So let's talk a little bit about the screening. Exactly when should people start to get screened, and what's that process like?
Sure. So there are guidelines, and really when to get screened depends on when insurance is going to pay for that screening. And one of the national bodies called the USPSTF, which is United States Preventive Task Force, looks at all the data and determines when a person should start getting screened. Now, the word screening means screening for apparently healthy, normal individuals. And they recommend screening women if they have no symptoms and no risk factors at age 65. If they have normal bone strength, some new data says they should not be screened for another 10 to 15 years because they're not going to get to the level of osteoporosis. If they have moderate moderate osteopenia. Osteopenia is just a lesser magnitude of osteoporosis, so bones are insufficient but not, highly porous. They recommend checking it again in about 5 years. And if they're advanced osteopenia, then a repeat could be done every 1 to 2 years. For men, I think we would have hoped there were some guidelines to check them at a certain age. Men generally develop osteoporosis later on and less often. There is no data suggesting that men benefit from screening. So the USPSTF guidelines say women above the age of 65 or at 65. It could be done sooner if there are risk factors such as somebody who smokes or drinks excessively or has a family history. For men, no data exists, therefore, case-by-case basis, pretty much.
All right. If you just joined us, this is KSMQ Health Connections. Every week we bring in experts from Mayo Clinic Health System to answer your questions about health. Our topic this week, osteoporosis. Our phone number and email address are on the bottom of the screen for most of the show. Dr. Sumit Bhagra, the medical director at Mayo Clinic Health System, is here to answer your questions. Dr. Bhagra, that statistic there about hip fractures and the number of people who die after a hip fracture, or let alone loss of mobility completely, it's scary.
It is. The interesting thing is that many people think of a heart attack or cancer as being a very bad diagnosis. And unless you've had a hip fracture yourself, you tend to think of a hip fracture as a fracture, because most young people have a fracture when they're playing in the yard, or a wrist fracture. They associate that with being active. The statistic that we just talked about, hip fractures are probably as bad as having a diagnosis of a moderately aggressive cancer or a heart attack, because they do lead to lack of mobility, people ending up in a nursing home, and then the infections, the blood clots, etc. that follow. So it is a big deal.
All right, I believe we have a question. Nathan, what do we got?
We do. We have an email from Bob and Albert Lee. Bob's asking, is drinking too much pop or soda, does that increase a person's risk for osteoporosis?
Great question. In fact, both caffeine and drinking beverages that have a lot of acid in them, phosphoric acid, in large quantities would lead to leaching out of the calcium from the bone. So folks that drink gallons upon gallons of iced tea or coffee or beverages, pop, etc., would have been seen in population-based studies to have osteoporosis slightly more often.
So it's not even the lack of calcium that you're taking in, but it's the acids that you're taking that complicate it.
Absolutely.
Interesting. I believe we have another question. Nathan.
We do. Laura from Austin called in, and she was asking about calcium in the diet. What foods should you eat? How much? And do supplements make a difference?
So the question is about calcium in the diet, and 1,000 to 1,200 milligrams of calcium daily is considered appropriate. Now that includes both the diet and the supplements. Many people end up taking 1,000 of supplements and 1,000 in the diet, and that might be too much. So as long as you're getting about 1,000 to 1,200 milligrams a day in your diet, as well as the supplements, you should be fine. And as an example, a glass of milk, 8-ounce glass of milk, has about 300 milligrams in it.
So like 4 glasses of milk puts you over the top.
It does, yeah. So supplements might be overused, especially by young, healthy people. A glass of milk, a serving of cheese, green leafy vegetables, etc., probably does the 1,000 milligrams a day.
2 quick questions. First of all, can you take too much? You were talking about perhaps it's too much. So what if you take too much calcium?
Sure.
So
if you take too much calcium in the diet, the body tends to be forgiving and the complications are rarer. But if you take too much supplementation as pills or multivitamins and what have you, the risk of kidney stones goes up slightly. So beyond 2,000 milligrams a day, that risk starts climbing up, more so with the pills, less so with diets.
Ouch.
Yeah.
Okay, I believe we have another question. Nathan.
We do. Mary called in. She's asking about the role of vitamin D in osteoporosis. And should she take in a supplement?
So another great question. Vitamin D, the recommended daily intake is approximately 600 to 800 international units per day. And again, food supply in the United States is fortified. Many people do get that amount, especially if they're young, healthy, and eating a wide variety of substances. Where we in Minnesota get into trouble is we spend a lot of time indoors. Some diets might not be optimal. The midday sun is the most effective in producing vitamin D in the skin. And our midday sun, many people aren't out in the midday sun.
You're working.
Our winters are long, and we generally get our walks, early in the morning, late in the afternoon, when the sun's rays aren't hitting the skin at an angle to make vitamin D. Plus, the sunlight exposure, relying upon that, is inadequate. It may result in sunburns and skin cancer as well. So if a person has restricted dietary habits, or they do not habitually drink milk, etc., taking a supplement that gets them approximately 600 international units per day would be appropriate.
And is it I was talking to a woman just before we went on show, and she was saying she takes more vitamin D in the winter. Just the rest of the year she feels okay, but during the winter.
I think that's a common practice, and I do ask my patients who are deficient to begin with to start taking slightly higher doses November through March, those being the colder months. And I typically use, say, a common holiday, Thanksgiving through Easter. You could take some supplementation. Remainder of the year, if you do forget or take it less often, that might be okay too.
All right, Nathan, we have another question.
Yes, we had a call from Maria. She asked a question about having a history of kidney stones, and how does that complicate getting enough calcium in her diet and taking supplements?
So what do you do if you're worried about the kidney stones, which are very painful, but you're also worried, obviously, about the osteoporosis?
So I think this is one situation where I'd say consult with your provider, physician, find out why you had the kidney stone. There are many reasons for why people develop kidney stones. Paradoxically, some people who consume a lot of salt may develop kidney stones. So common table salt might result in calcium-containing stones. Some folks have kidney problems where the kidneys cannot hold on to calcium. So if you've had a kidney stone, I think it needs to be run past a medical professional to find out what your customized goals for calcium and vitamin D intake might be.
When it comes to calcium, is it ever too late? I mean, because we were talking about it's during your teens and 20s when you build up this bank of, good bone mass. So if you didn't do it when you were in the teens and 20s, is it give up the ship?
Never too late, actually. So if you start by 30, 40, 45, just making sure you're eating right. I think as people grow up, they pay less attention to their diet. So when they're 15, 20 years old, the body is anyway growing at a fast pace. The hormones take care of making sure the body is growing well. I think it's when people hit 30 and 40, they start paying attention to what long-term diseases may affect them going forward in time, looking at their family history, etc. So it's never too late. Certainly by 30, 40 years of age, people should be looking at preventing osteoporosis, particularly women.
All right. Dr. Sumit Bhagra, the medical director at Mayo Clinic Health System, is here to answer your questions. We have a bit more than 5 minutes to go, so there's still time for you to give us a call with your questions about osteoporosis. That is
I've just closed my eyes again, climbed aboard the Dreamweaver train, driver, take away my worries of today and leave tomorrow behind. Ooh, Dreamweaver, I believe you can get me through the night.
all right. We're running out of time, but we still have time for a few more questions, so don't be shy. Nathan, I understand we have a question right now.
Yes, Melissa from Blooming Prairie called in. She has a question about exercise. She heard exercise can help prevent osteoporosis. She's wondering how this works.
Sure, great question. I think when people think about exercise, they think about, cardio exercises, hitting the ellipticals or running or being outdoors. And all that helps build muscle and to some extent bone as well. But many people forget that it's the weightlifting part, the resistance training that truly builds your muscle strength, builds the muscle bulk, puts pressure on the bones for them to become stronger. And I think historically women tend to overlook the weightlifting part, and they perhaps focus more on the cardio training part. That's changing though. I see a lot of young patients who do both. So weightlifting really helps bones, muscle strength, flexibility. And interestingly, if you exercise your body, the agility goes up as well. So if you were to stumble and fall, you are more likely to break that fall with your hands as opposed to hitting the ground on your hip and ending up with a hip fracture.
Let's talk about medications. So you get diagnosed. What are some of the options and what are some of the drawbacks?
Sure. So historically, I think estrogen was used until the year 2001 or 2 as a prevention for osteoporosis, even a treatment for osteoporosis. Bottom line, it's fallen out of favor. Lots of risks, including increased breast cancer, blood clots, and what have you. We now have safe and effective medications to prevent and treat osteoporosis. I think if you look at a broad swath of people, the commonly used drug is bisphosphonates, which is a group name for the common brand names you might see on TV, such as Fosamax, Actonel, Boniva, Reclast. They're either given as tablets or taken as intravenous injections. Boniva and Reclast are available as injections. The other 2 or 3 medications are available as pills. So that's your number 1 class of medications used across the country and very commonly used. Rarely there are some estrogen-like chemicals available, Evista being one of them. It is used infrequently. We do have medications such as Prolia that are new and used for people who cannot take bisphosphonates. And then we've got expensive daily injections such as Forteo and Tymlos that are used as well.
Always depends on the person and how they take a particular medication, but there are always risks, drawbacks, side effects. Talk a little bit about that.
So 10,000 foot above the ground level, any medication that you take or was prescribed to you by your physician has a side effect. The fact that you take it is because the benefits outweigh the risks, and it is true for the bisphosphonates as well. 2 or 3 years ago, mass media sensationalized the side effects, and it is true that rare side effects can occur, such as osteonecrosis of the jaw, which is inability of the jawbone to heal after you get your tooth taken out, or atypical fractures of your thigh bone. The incidence of those complications is 1 in 10,000, 1 in 100,000, 5 in 10,000. Those risks are outweighed by the potential benefits of these medications. So if I could just give one message, that would be to not take these risks as black and white. They're not all or none. All medications we take have side effects. Make sure you talk to somebody who can present the risks and benefits to you, and then come to an informed decision.
Because if you're talking about a 1 in 1,000 chance or 1 in 10,000 chance versus like a 1 in 3 chance of breaking a hip.
Exactly.
Yeah. Okay, I believe we have a question. Nathan?
We do, and again, I understand that for most people that we can't offer medical advice on the show. There's somebody who's calling who's taking an anti-cancer medication called letrozole, and they've heard that there are risks with this medication. What can you suggest for her?
So again, the show is not for medical advice, but this is a great question. It's out in the weeds a little bit because letrozole is a chemical that makes the production of estrogen in the woman's body down to 0. Some breast cancers are estrogen sensitive, so this is done intentionally to reduce or starve the cancer of the estrogen. The effects on bones can be quite catastrophic, and it does require a discussion with the oncologist as well as the bone specialist, whoever it is that you might be seeing, to discuss how to prevent the effects of letrozole on the bone. It's a great question.
We got about a minute to go. Talk a little bit about, give us a little bit of hope. What's sort of out there? Is this going to be the problem 20 years from now that it is now?
So Americans are living longer. As we see more people living to 80s, 90s, and 100s, it will become more and more of a problem. I do see hope that the new generation that I see in their 20s and 30s, they are paying a lot of attention to how they eat, how active they are, and trying to live the right lifestyle. And hopefully that generation will become older and not face some of the consequences that people today face.
So you are feeling a little bit more helpful, but basically it's, heal ourselves. It's instead of trying to fix the problem, let's avoid it.
Absolutely. It's a lifestyle disease. It's somewhat predestined in our genes. As we live longer, grow older, the bones will become weak. We can do things when we're 30 and 40 years old to prevent this problem from occurring later on in life.
All right, that's the final word. That is all the time we have for tonight. I'd like to thank the RNs who handled the phone calls, especially Nathan, and Dr. Bhagra. Thanks for taking time out of a very busy day. Thank you very much.
Thank you for having me.
Thanks, and thank you for watching and sending us your questions. Next week, a topic that a lot of people may not immediately think of as a health problem: getting a good night's sleep. More than 1/3 of us don't get enough sleep, and that causes all sorts of health problems. We're going to not only talk about why we all need a good night's sleep and some of the health complications, but we're going to talk about strategies on how to get more and better sleep. So, before you go to bed tonight, you can email us your questions or give us a call live next Tuesday night. Hope you can join us.